This is part 2 of our video lecture for chapter 47 in your Modern Dental Assisting book. In this lecture, we're going to be talking about custom impression trays and also dental waxes. So, criteria for creating custom impression trays include that the tray should be significantly rigid. We want to make sure that it's fitting and adapting well to the arch. The tray must provide accurate adaptation if the patient is edonculous or partially edonculous. Tray must maintain an even distribution of impression material throughout. The maxillary tray should be covering the teeth and then also the hard palate, and then extend slightly beyond the gingival margin of the last tooth there. The mandibular tray must cover the teeth and extend beyond the gingival margin. Guidelines and terminology for creating a custom impression tray undercuts should be filled with wax or other modeling material. Outlining the tray, this is going to designate the area to be covered by the tray. The spacer is going to create room for our impression material. And then the spacer stops allow for adequate impression material in the tray. A separating medium so that the completed tray can be removed from the cast that it was created from. Handle is going to allow us to easily place and remove the impression material in the tray. Spacer removal so adhesive will stick properly. And then finishing so it's not rough to injure the patient. Acrylic resin tray materials, we have our self-curing acrylic resin. This is strong, easily adaptable, liquid monomer. It's highly volatile, not dimensionally stable for 24 hours. Our light cured resin has a very low shrinkage. It doesn't contain hazardous material. And then we have our vacuum formed thermoplastic resin. It's a heat and a vacuum formed sheet of resin, and it conforms to that model. Dental waxes, these can be made from natural or synthetic. We have a variety of waxes here that would be used in the dental laboratory. In the classification, we have three general classifications of our waxes, our pattern waxes. This is going to include the inlay, casting, and base plate, our processing wax, our boxing, our utility, and our sticky wax. And then our impression waxes are our corrective impression wax and our bite registration wax.